I am concerned that there might be something wrong. We need to get some tests.
Okay. I want to do the right thing and be healthy.
We'll get them ordered.
So, how much will it cost?
I do not know.
What do you mean? You do not know?
I do not know how much the tests will cost.
Why not?
Nobody knows how much anything in healthcare costs.
But you are the one ordering it.
That doesn't mean I know. I don't know any more than you do.
But you are my doctor. It's your job.
It's my job to know about the medicine, not about the costs.
But
I don't even know how much it will cost you for this appointment.
why not?
Nobody tells me.
That's ridiculous.
I just put a code down on a form. Usually it is a 99213. Maybe it will be a 99214.
What does that mean?
There is a grid to determine it based on elements of history, review systems, body parts examined, and complexity of medical decision-making.
That sounds complicated.
It's more complicated than your actual medical problem.
That's not reassuring.
There are some special tricks. If you have a cold, it would be a 99213, but if I give you an antibiotic you don't need, then that would make it a 99214.
You give me a medicine I don't need and you get more money?
Yes. But I do not know how much, because I do not know how much either one costs. Also, if you keep asking questions for more than 25 minutes, that's a 99214.
Oh.
But it's much faster to give you an antibiotic for a cold. And more fun.
But back to how much the tests cost.
Somewhere in some file is a list of charges. But it's probably not up to date, and even if it were, it wouldn't mean anything.
Why not?
The charges are just for show. Nobody pays them unless they are uninsured. Otherwise, your insurance has a deal worked out for the real price. Then they pay some and you pay some. I don't know how much. It's different for every person.
Oh.
Also, if you do the tests here versus down the street, the charges are different and your payment will be different.
How can I find out the cost?
I don't know.
But it's important. I need to know if I can afford to do the tests.
Maybe someone at each place knows the prices. But the cheaper one might be more expensive for you and vice versa. It all depends on their deal with your insurance.
Can my insurance tell me?
Have you ever tried to get your insurance to tell you anything? Think of it like an airplane. Healthcare people like analogies about airplanes. You paid a different amount for your ticket than the person sitting next to you. Everyone paid a different amount and no one knows how much. But nobody gets angry.
But at least I knew the price when I bought it.
Well, the analogy breaks down there. Oh look, you stayed long enough that I can code a 99214.
This is insane.
This is American healthcare.